Everyone. You're tuning in to Encouragement on Fire, and I am Shirley Farrar, and I am so glad that you are tuning in with us this evening on YouTube, Sunday, 8 p.m. So if you are with me, let me know in the chat that you are with me. I will have Pastor Darrell Farrar, who will be joining me soon to the conversation. I'm telling you guys, I'm a little upset because I did an entire half an hour taping for you, and I have to do it again because on YouTube it would not render, or the processing would not process fast enough for I can upload it for you. So now I'm doing it live because I need to get this information out to you. So today we are talking in regards to lymphedema. So what is lymphedema? And who are the people that are being affected by it, as well as are there some treatments to lymphedema? Now, a friend of mine, a wonderful sister in the Lord, shared with me some information, and I wanted to read up about it. So that's what I did. And I wanted to bring this information to you because I thought that anything that is a sickness or disease, acute or chronic, anything of that nature that is in result of, cancer or anything else, we need to bring it to your attention. It's not for everyone, but it's for some of you out there that really need to hear about it. So, what is lymphedema? So, I'm getting my information from cancer.org as well as the Mayo Clinic, both reputable resources that you can utilize as well. Um, so, it says it's a buildup of lymph fluid in the fatty tissues just under your skin, and it can affect your legs, it can affect your face, it can affect your neck, trunk, abdomen, belly, your genitals. It can affect so many parts of your body, your arms. So we have to be mindful when we may see someone who is going through this process. First of all, be kind, because it could also happen to you. And, if you see someone who's really exhausted and they're in this condition, prop up their feet, help them out a little bit, because they're going through their process. Um, Sometimes the lymphedema can be severe or it can be not as severe. So we're going to talk about acute and chronic. What's the difference of the two? But the lymphedema, um, you know, it says here that the system is part of your body's immune system, the lymph. So let's look at that. If your immune system has been destroyed, if your immune system has been, the quality of it is not as good, then you are subject to getting lymphedema. And just like anything else, any other sickness, any other disease, you are subject to it. And so let's look at that. What do we need to do moving forward? So the lymph system, um, is your lymph fluid, right? It is the lymph vessels or ducts. It's the lymph nodes. I remember when I was a little girl and my tonsils needed to come out. Now I have my tonsils right now, but I'm just letting you know that I needed to have my tonsils come out. So all of that is part of the lymphatic system. And if the doctor said that you need to have it out, then there was a good reason. How you doing, Sister Josephine? So the people at the church, they prayed for me. And then I went back to the doctor, and guess what? He said, you don't need to have them out anymore. I said, what? And I was a little girl. So to me, I felt that that was a miracle. I was able to keep my tonsils. Now, do you need them? No. But I was able to keep them. And then it also affects some other, other places in your body. So I want you to definitely look up this information later on. So today, again, those that are tuning in, we're talking about lymphedema today and how it affects our body. And we're bringing this good information to our listeners, because it's important. You're important. And we want to make sure we're getting you everything possible. Um, you know, let's see if we can get that lymphatic system working. Let's see if we can get ourselves in a place that we're healthy and we can help other people. Remember, I told you before, you can't help anyone else until you put yourself first, your self care first, because you are important. Now, what are some of the signs of lymphedema? That is the swelling. We talked about the different places on the body that can be affected, but that's the swelling of body parts, skin feeling tight or hard, aching, tingling, numbness, the lack of flexibility. Now, these are some of the symptoms I was getting, but remember, mine was a different result from the cancer, the treatments that I was getting from the chemo, and some people get it from the radiation. But it says that not only the neuropathy, like we talked about in a previous podcast, this is another lymphedema. You can get this simply from those type of medications that the doctor gives you. So there's many ways, and we'll talk about that as we're moving forward. But I want you to make sure that you're mindful that this is treatable, even though in some stages they say if you're at the extreme stages, it's not. But we're faith-based people also, some of you on here. And so we believe that, God heals and God helps us to understand what's best for our bodies. And so that's what we're doing today. We're looking at that. So let's think about the stages of lymphedema. So the stage 0 is no swelling. Now, I know you're thinking, what? And then it says minimal symptoms. But remember what we said in a previous podcast. It's really important that we write down symptoms as we're getting older, right? Come on, we're getting older. Maybe I have some young listeners on here, but even young listeners, you're getting symptoms of some kind you weren't feeling yesterday or last week. So you need to write them down. That's what one of our doctors that came on our show told us. Write those things down, the day, the time of day that it happened. So then later on, when you're talking to your doctor, they have a good understanding of what is going on with you. Remember, doctors diagnose what? Symptoms. Okay. So you have to tell them the symptoms in order for them to be to diagnose you properly. The stage 1 of lymphedema is the swelling of the affected area. So remember, your arms, your legs, your neck, your face, they can start to swell slightly. So we have to be mindful. Now, is it always lymphedema? No, it could be something else, but just write it down. Tell your doctor what other symptoms you're having, and that you can bring that to their attention. And then it has stage 2 is more swelling than stage 1. So if you notice that your arms or your legs are really inflamed, guess what? That's what it may be. And you need to get a professional to be able to diagnose that. And then, of course, stage 3 is where we're getting more into the chronic. And we need to have already started to address it or really get right in there and talk to the specialist about it. You don't want it to get to cellulitis, and that is an infection in the tissues just under the skin. So remember, we know the lymphedema can affect you with the swelling, but we don't want it to get to an infection. Okay. Now, if some of you are listening and you have gotten to that place, you definitely need to be changing your eating. You definitely need to be lifting up your legs, your arms, those type of things. You're being proactive with the herbs that we've been talking about, the turmeric, the cumin. You need to make sure that you're talking to your doctor, the specialist. We're going to talk about some of the ways of treatments that really have helped people moving forward. All right. So we're going to get into that actually right now. So let's go back. There's 2 kinds of lymphedema. There's the acute and there's the chronic. Now we have talked about other sickness and diseases the same way. There's 2 different kinds. So if it's the acute, that's a short term. That means that it's a temporary thing, possibly because of a side effect from medication or side effect of a disease that you just went through. And, you know, you might have just it might be the early stages and then it goes away. But it could be chronic where a year after you just had like I had the chemo. Some people have the radiation. A year after that, all of a sudden, the lymphedema affects their body. So you need to know, is this acute or chronic? And if that's the case, if it's chronic, something that's been with you a long time, or it's a year after you've had a sickness or disease, you have to begin to address this. So it shows up possibly a year later and it's very uncomfortable. So I know some of you are thinking, do I have, if it's not very uncomfortable, it's probably not chronic. It may be acute, but it's not chronic. And also, this is when it's chronic, it keeps the nutrients from reaching the cells, and that's something you don't want. So one of the things that we talked about in our previous podcast was massaging the body, right? Getting the lymphatic system moving. This is something that we need to do. We talked about getting on the trampoline. Remember, we talked about that in the previous podcast. It helps the lymphatic system move, the all the toxins move through the body and exit. We're always talking about the kidneys, or we're talking about, the liver having that job. And they do. They have that job. But remember, even in in the Bible, it says all things work together for our good, right? So think about it this way. You want to make sure that, okay, my lymphatic system that's helping my liver, is helping my kidneys, is moving those toxins through my body. Okay. And if it's not, I need to get on my trampoline so I can jump, 5 minutes here and there, get it working. Now, if you can't get on the trampoline, then there are other things you can do. Okay. Sometimes people can do a little bike riding, this the one that's in place. Sometimes you can get on the treadmill. Sometimes there's other activities that are low impact you can do until you can get to that. But don't stay stagnant doing nothing. And I'm telling you this because I care, and we got to start moving. I'm saying to you, I'm encouraging you. You got to get out there, start exercising, even if it's a walk. And I'm getting ahead of myself in some of these treatments, but even if it's walking, we've got to start moving. If you've done 1,000 steps today, tomorrow, try 2,000 steps. Walking around the house, walking up the neighborhood, getting some fresh air, doing those type of things. So what are some of the treatments for lymphedema? So let's talk about it. We want to reduce the swelling, right? We want to keep it from getting worse. Those are our goals, and we do not want infection. One of the things we talked about before was, when I was going through the chemo, I did a little scratching. Doctor said, no, 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 you can't do that because you don't want infection. No different with the lymphedema. You do not want your dogs, scratching you, those type of things. So make sure you're trimming the dog's nails, those type of things, so that doesn't happen to you. But what are some of the treatments? So the number one treatment is the manual lymphatic drainage, or MLD. So this is a massage by a specialist. So is this deep tissue massage? No, it is not. But it's a special type of massage that they do in order to help you to move that lymphatic system, get it going. Okay. There, another one that they mentioned in the research for the cancer.org was complete decongestive therapy. And that is done by a specialist. It's skincare, special compression bandaging. So if you are interested in that, look it up. Right? We're only mentioning it. Look it up, find out the information for yourself. Maybe it's something that's going to be good for you. The third one is intermittent pneumatic compression. So we want to make sure that there's this device that fills with air and then deflates. Pastor Darrell actually had talked to us about that before, and it's really good. It's not just for people who are dealing with the treatment for the lymphedema, but also some other things. It may be helpful for you. So request to your doctor. Then there's compression garment. I told you guys I used it on my feet as well as my hands. It did help me. So I'm saying to you, you want to make sure you're looking through all of these. And the other one is surgery. We always want to eliminate surgery if we can, but it may be something we can't and we have to go to it. But all doctors they're going to tell you, you don't want to get to the surgery. You want to make sure that you try everything else, right? Everything else, so you don't have to get to that point. And that's doing your herbs, that's doing your exercise, right? Whatever other things the doctor's asking you to do, because everyone's different, make sure you're doing those things. And then, like I said, surgery should be the last. That extreme medication should be the last resort, but you must work with your doctor in order to go through the process. And also, I want you to know that many of the things that we mention here, insurances do cover a great deal of it. Do they cover everything? I'm pretty sure they don't, but they do cover a majority of it, and you should look into that. Remember, insurance companies are about preventive care, right? At least that's what we hope, about preventive care. So you want to make sure you do your due diligence, so then you don't have to put out money out of your pocket, and they don't have to put out more money from their end, right? And we can live healthier lives. And then let me see here. You also want to avoid wearing too much tight clothing and jewelry. And you want to get good skincare. Now, that's something I'm still working on. I'm kind of going back to some of the old things that my parents taught me. And also some of the things that are in, our cosmetic places and things of that nature, good for people who have had chronic illnesses. You want to make sure you're talking even to the specialists that do skincare, because they can help you with products that help with circulation, those type of things. You want to make sure you're doing that. And make sure you're doing regular exercise. Now, I want to tell you that in this process, we all need an advocate. We need an advocate. I'm here. I'm advocating for you because I'm always bringing you information. But you need an advocate. And there is an actual association. It's called Lymphology Association of North America, or LANA. And they're online, so you look that information up. But they're a health group advocate. We have Pastor Darrell joining us, as you guys can see there.
Hey, how y'all doing?
Especially when you're going through, you need more information than what we're providing for you today, and you want to get additional information, whether you're going to YouTube or with reputable resources or Google. You want to also go to associations like LANA, who are going to help you in getting researched information and the like. Okay, so make sure you're doing that. Let's see. Also, if there's a caregiver that's listening and you're saying, wow, the person that I am looking over has some of those symptoms that we talked about, make sure you're bringing it to the doctor's attention, which I don't have to tell you that, because you're in a professional. So you're making sure you're checking all those wounds and making sure you're getting them the right care. Okay. And so we're going to move on. We're doing pretty good with our time. We may end a little early today, but we're going to talk about a few things. Is there anything you wanted to say?
No, I know you touched on it already. I was running around doing some things here.
That's okay.
We talked about the massages already?
Yes. So we have a few of them on here.
Right.
There's a few of them there.
So you already talked about them.
I just mentioned them, but if you want to say something.
So, one of the ones that's on here, the intermittent pneumatic compression, I was talking while we were speaking about it earlier. When you go to one of the places that does this, it's actually, if I could say it, they would be like air pants. They were put on you, and they fill up, they compress your leg, and then they decompress. They compress, decompress, compress, decompress, and it's doing it to get your blood flowing to problem areas. It allows your if your legs are wounded or injured, it allows the blood to flow there faster, so you can recover faster, so you can heal faster. So these places are all around the region. You just got to look them up. There's one in Marlton. I'm not going to plug their name, but there's one in Marlton, right on Route 73. They're very good in holistic. They have doctors and nurses on hand while you're going through these type of activities there. So it's not just for those that are going through the lymphedema, but it's for anyone that wants better circulation in their blood, in their body.
Yeah.
All right.
Wonderful.
And cryogenic features too.
And I did mention to them that you talk about that a lot. And I'm so glad that he had an opportunity to tell you about it. And if we're moving forward, we want to talk about, and like I said, from cancer.org, They have for people at risk of lymphedema, and they have on here, it is related to cancer, is most commonly caused by lymph node removal during surgery for cancer, radiation treatment to the lymph node area, and or by tumor itself, which might block part of the lymph system. Increased white blood cells due to leukemia or infection. Remember, we need our white blood cells.
Mm-hmm. That's the defense mechanism.
It is the defense mechanism. We talked about the immune system being down. So if you're going to the doctor, like we're always telling you, you need to be getting your blood work done.
Get your checkups.
Find out what they can do a extreme, what is it, metabolic of your blood, what vitamins you don't or do have in your system.
Deficient.
They can tell you trust me, I had it done every single week. I was going for these chemo and treatments. They can tell you everything you do and do not have. And it's probably under your insurance. It may not be you may not be able to do it every month, but you can do it maybe 6 months. I don't know, based on the type of insurance you have. And whatever it's saying you do or don't have, or you have to adjust your eating, you may have to do that. And that's okay, because it's all about, the next day, living my life to my best, right? Living my best life. How can I do that? I don't want to be in this same place next year. Next year, the same time, like right now, this is what, October. September, excuse me. We're almost October. September 2022. From a year from now, the doctor told me, lose weight. He said, gradually, do not lose rapidly. That is not healthy for you. So gradually doing that. My circulation, I want to make sure it's better. So I'm doing remember we talked about the lymphatic drainage products that we talked about in the previous podcast. I want to make sure that I'm getting on my treadmill, on my rebounder. The rebounder. Yeah, that's the name, rebounder. I'm doing all the things.
I'm just gonna play basketball with me.
Yeah, and I can play basketball with him, or do my jumping jacks once my feet allow me to do that. There are things that I do now or I can't do now. A year from now, my plan is to not be in this same place, that I will be better.
You know what's ironic is that when we're younger.
We're talking about I'm young now.
Okay. Nah. When we're younger, we're talking about
right in your 20s,
maybe we
because I know some of y'all 30-year-olds think not.
I want to go back.
You're getting older.
Even prior to that, I want to say in our late teens,
right?
Like things don't affect us like they used to. We
Absolutely.
can eat everything and we can consume everything and do things and whatever, and we're vibrant and we're lean and we're toned, and we're not sedentary. And as life starts to take its toll on us, we tend to relax, but we don't change our eating. And the things that we used to be able to get away with, we can't. And so there is a price to pay for that later on in life. And so
it's something that you're saying that, because I had a conversation with my father tonight, and I told my dad, I said, I really appreciate you and Mom, because when I was going through all of this, they taught me how to eat right. See, we get away from things that our parents teach us, but they taught me, Cheryl, these are the roots that should be in your diet all the time. This is the way you should eat naturally all the time. And because we're in society, we get away from it. We're doing all these things. Like, we never use toothpaste. Now, I know you guys are like, what? You never use toothpaste. We never use toothpaste. I always used herbs and coal and baking soda. There are things that I used as a child. And guess what? I still have all my teeth. And guess what?
Didn't have cavities.
My father does too.
And he's 70-something.
He's 70-something years old. You understand? So, and he got pearly white teeth. So I'm saying to you, you don't always need to go to these extreme toothpastes. All right. Now, because I didn't do some of the things I should have done, now there's some certain toothpaste I have to use because I got away from my natural way of living.
And also, there are things now that they're finally, I think they've known all along, but they're now just getting out, and they have no choice but to, because people are going to tell it anyway. To find out that a lot of things that we have in our yards that we consider, oh, that's nothing, no good for you. Well, find out that it has a lot of beneficial uses for you, such as, ready for this? Dandelions.
Yeah, absolutely.
Dandelions all over the yard. You're like, oh, I got to cut them weeds out.
Nope. Good for you. Salads.
Those weeds, that yellow weed is probably one of the best
dandelion tea.
It's one of the best things that you can consume to help ward off a lot of your diseases and maladies that your body may start to incur. They've always said
we used to have alfalfa. Used to grow in our yard.
Mint.
We had, when I say roots, my dad would say licorice, things that he would say, going out there and cut that out, because we had a garden. So I would cut it out. And then we would have big roots and we would boil them.
Yeah. So what is that root? Is it like, I guess it is licorice, or it's gotta be rhubarb.
Rhubarb, that one too. Yeah. So there was a lot of different things. And because my parents taught me those things as a child, not that it was easy, because I told y'all some stories trying to adjust back to the way I was eating, but because of that, I was able to kick in faster. I was able to, the reservoir, it was there. You know how if you don't have something in the reservoir, you're depleted. That's it. Well, the reservoir of my past thinking, it was there, and all I had to do was activate it, like we were talking about before.
So literally,
it's a side joke.
So literally, you just had to reset.
That's what I had to do.
Button.
That's right.
You press the reset button. You go back to the way you used to be, the way you used to think, the way you used to talk, walk, eat, and whatever you do then, it can come back into form, because it's waiting for that.
Right. So if you are a person that has gone through cancer or radiation or chemo, you will be more susceptible, they say, to lymphedema. Okay. You heard what I said? That's what they say. But we're going to do all the due diligence, exercise, different things, so we won't have that situation. So how can we reduce our risk? We're going to give you a few different ones right now before we get off, because we're ending. You're going to get regular medical checkups like we've been talking about. Come on, right? Getting those blood tests regularly. You're going to report any changes to your doctor. You're going to be noting every day symptoms that you're occurring or that have gone away. You're going to stay at a healthy weight. Remember, I talked about I'm trying to now do this every day. Whatever exercise I am able to do, I try to push myself without hurting myself and doing what I can do. Okay.
And listen, no matter what age you are, if you're able to go online, look up your BMI, your body mass index, for your height, that'll tell you what your ideal weight is. You're going to say, "What? I can't. There's no way." Listen.
Yeah. I know mine is like, oh my goodness, I don't even want to talk about it. But a year from now, I'm going to be in a better place.
They told me mine was, I'm 6'2", and mine was 211.
Okay.
And I got down to 211. I said, "Oh my God, I'm skinny."
Yeah, he was too skinny.
Skinny as a rail.
Skinny, so yeah.
But that's my prime BMI.
Right.
So that means the fat is literally gone.
Right.
I'm just lean then.
And you just have to make sure you're toning and doing what you have to do. And then the other one is exercise. That's how we're going to reduce it. If you're not exercising right now, you must start somewhere, and each week, every month, increase what you need to for your body, not somebody else's.
Right.
Avoid skin infection, burns, and injuries. That's important. Be careful with injections or blood drawn. All of these, like I said, cancer.org, you can get this information. And watch signs of cellulitis infection, certain type of infections. You want to avoid that under the tissue, okay? We talked about the restrictive clothing. Be careful, mindful, you're not suffocating your body. You don't want to do that. The compression should be enough support, but not to the point where it's causing pain. Okay, because that's another thing that doctors tell you. That's not what we're saying. But I think that if we take the time to know ourselves, our whole selves, and who we are, You take, like my parents used to say, take the meat, leave the bones. Okay. So whatever we're saying today, if
Find
there's
out what's useful for you.
yes, there may be one item out of the entire 30 minutes. If that helped you, we are so happy and grateful. And maybe some of the stuff's not for you, but you can share it with someone else and then tell them some of the places that we got this information, because maybe they're readers and they want to read it for themselves.
So the last thing I want to say is that today during the sermon, one of the scriptures says, let our words, our speech be seasoned with grace.
That was a good sermon too. You got to look it up.
Let it be seasoned with grace and salt, so that we may be able to know how to speak to one another. Why? Because it ministers grace to the hearers.
Yeah.
And so we hope that, whatever we give you, whenever it's an opportunity for you to hear it, that it ministers grace to you, that triggers you to tap into what's inside of you.
Yeah, absolutely. Because this is encouragement on fire. Come on, y'all. You can't get any more. Encouragement on fire. You will survive. You will come through your process, and you're going to be successful in what you need to do for you. Okay. This is Pastor Darrell Farrar, and I am Shirley Farrar, and you have just been a blessing to us today for watching 8 p.m. on YouTube. Come back again next week. We'll talk to you soon. Bye-bye.